Hello, my name is Sarah Johnson. My needs assessment presentation will be going over mental health treatment, looking at inpatient treatment for youth here in Pueblo, Colorado. So the purpose of the needs assessment is that with the rising focus of mental health, youth mental health tends to be pushed back. The problem in the community leads our youth are learning how to cope with how to use coping skills poorly, or learning poor ways of using their coping skills. We need to teach the youth new coping skills while providing more programs and resources of, that would be available to them within the community, um, as well as finding crisis services for youth, such as 23-hour respite programs. So I interviewed 4 people. Um, these people are people I knew in the community, as well as people who work within Health Solutions. Uh, these individuals have worked directly with youth, uh, and the participants work in various roles, including a hospital, ER, um, the crisis youth service, and as well as an MST program where they go into uh, homes and work on family role in bringing families together. I interviewed them through email, and I asked 13 questions plus 4 demographic questions. The people I interviewed is Allison Patsos. She's an MSW, LCSW. She's the MST supervisor at Health Solutions. Amanda Carlson, she's a BSW. She works for DHS on their adolescent unit. She's a caseworker. Gwen Ferguson, PhD in clinical psychology, he's the director of the Youth and Family Services at Health Solutions. And Roger Hemmelrich, he has his bachelor's degree. He works as a crisis intervention specialist at the local hospital, Parkview ER. So the main findings is that the participants believe that youth can overcome their mental health challenges. At Health Solutions alone, they serve over 5,000 youth. Amanda states she serves 22 youth and their families. The participants also agree that if inpatient is needed, it should be somewhere close so families are able to participate in the treatment, as well as being able to follow up with outpatient treatment as well. And they need to work on building stronger family ties. So the main issues that people are facing is lack of treatment, waitlisting for treatment, the substance abuse issues, poverty, gangs, violence, systemic school and legal systems, lack of family focus on education, exposure to trauma at an early age, homelessness and sex trafficking, and intersectionality in terms of race, gender, class, and sexual orientation. So these are the strengths that the interviewers believe Pueblo has. Um, they say we have a strong outpatient treatment service as far as Health Solutions is concerned. However, there is a wait list to serve individuals. Um, the individual groups and counseling sessions that are provided are a strength. Pueblo has a strong sense of culture. Youth are able to access mentors through Health Solutions, and youth are smart, but just need. They believe that our youth are smart. They just need someone to believe in them. So my recommendations is Pueblo has one community center where the youth can hang out. At the community center, they do have a skate park and places to hang out. They also offer classes such as yoga. I think together with the support systems of the homeless shelter and the community, we could create a place for the youth where they can stay the night if needed. Um, just to have that time away from family, or just to get away and have someone to talk to. I also recommend training peers within schools to help with um, the stigma on mental health, just getting it out there and talking about it. Sometimes you feel more comfortable going to other youth. So having peers that they can go and just talk to about things, as well as training the youth when they need to make sure to talk to adults about what's going on. Also, just another place so they can get resources. So my plan to share my findings isn't with a Word document, just providing them a bullet point on what their peers are saying within the community that would be beneficial for the youth, so that way maybe they can collaborate their ideas and work on providing the best treatment. So I think that overall the experience was successful. However, there were some barriers that I faced, just getting people to come get back to me. So there's quite a few people that I did reach out to that were not represented as they didn't get back. I think the experience will shape my future assessments by learning um, how not to wait so long for people to get back to me and before I move on. And I think that people really want to help kids is just there's other barriers of having a place where you can help them get them to hang out as well as financial issues. Thank you for listening to my presentation.